Kidney disease has a nickname among doctors, the silent condition. Not because it doesn't cause symptoms, but because by the time most people notice something is genuinely wrong, a significant amount of kidney function has often already been lost, sometimes as much as half. Your kidneys are remarkably good at compensating for damage, quietly picking up the slack for years, which means the early warning signs are subtle, easy to dismiss, and very often blamed on something else entirely. Getting older, being tired from work, or just needing more sleep. Today, I'm going to walk you through exactly what your kidneys actually do, why the damage stays hidden for so long, the 7 warning signs that get missed most often, and why each one happens, who's at higher risk, what tests actually catch this early, and what genuinely helps protect kidney function going forward. This is a longer video than usual because catching this early is one of the areas of medicine where the difference between early detection and late detection is enormous. Let's start with what your kidneys actually do because understanding their job is what makes the rest of this video make sense. Your 2 kidneys filter your entire blood supply roughly 40 times a day, removing waste products, excess fluid, and toxins, which then leave your body as urine. Beyond filtering, your kidneys regulate blood pressure by managing fluid and sodium balance, produce a hormone called Erythropoietin that signals your bone marrow to make red blood cells, activate vitamin D so your body can actually use it for bone health, and maintain the balance of key minerals in your blood, including potassium, calcium, and phosphorus. When kidney function declines, all of these systems are affected. Not just urination, which is exactly why the symptoms of kidney disease show up in so many seemingly unrelated parts of the body. Fatigue, itching, muscle cramps, and swelling can all trace back to kidneys that aren't filtering and regulating the way they should. Here's why this stays hidden for so long. Kidneys have a substantial amount of reserve capacity built in, meaning they can lose a significant portion of their filtering ability, in many cases up to 50% or more, while still managing to keep waste products in your blood at a roughly normal level through compensation. This is a double-edged design. It's protective in the sense that minor temporary kidney stress doesn't immediately become a crisis, but it also means that chronic kidney disease can progress through its early and middle stages with no noticeable symptoms at all, which is precisely why routine screening through blood and urine tests matters so much rather than waiting for symptoms to appear before checking. By the time clear symptoms show up, a meaningful amount of function has often already been lost, which is why understanding the subtler, earlier signs is so valuable, even though they're easy to miss or explain away. Let's go through the 7 signs. The first is changes in urination. This is the most direct signal since urination is the kidney's most visible function, but the specific changes people miss are more subtle than most expect. Foamy or bubbly urine, particularly if it persists rather than being a one-time occurrence, can indicate protein leaking into the urine, called proteinuria, which happens when the kidney's filtering units are damaged and allow protein to pass through when it normally wouldn't. Urinating more frequently, especially needing to get up multiple times at night, called nocturia, can indicate the kidneys are losing their ability to concentrate urine properly. Decreased urine output, or urine that appears notably darker than usual, can signal reduced filtering capacity. And any visible blood in the urine, even a single episode, always warrants medical attention rather than being dismissed, since it can point to several different kidney-related issues. The second is swelling, particularly in the legs, ankles, feet, or around the eyes. When kidneys aren't filtering excess fluid and sodium effectively, that fluid builds up in tissue, causing visible puffiness, most commonly in the lower legs and ankles due to gravity, or around the eyes, particularly noticeable as puffiness upon waking in the morning. This swelling, called edema, gets attributed constantly to standing too long, an inactive day, or simply getting older, when it may actually reflect the kidney's reduced ability to manage fluid balance. The third is persistent fatigue and weakness that doesn't improve with rest. This connects directly back to that hormone we discussed earlier, erythropoietin. As kidney function declines, erythropoietin production drops, which reduces red blood cell production, leading to a condition called anemia. Anemia causes exactly the kind of profound, unrelenting tiredness that's easy to attribute to simply being busy, stressed, or getting older, rather than being recognized as a downstream effect of declining kidney function. The fourth is persistent itching, sometimes across the whole body, without any visible rash or skin condition to explain it. As kidney function declines, waste products that would normally be filtered out build up in the bloodstream, and this buildup is believed to trigger widespread itching, sometimes called uremic pruritus. This symptom is particularly easy to dismiss since dry skin and general itching are common complaints for many unrelated reasons, and the connection to kidney function isn't something most people would think to consider. The fifth is a loss of appetite, nausea, or a persistent metallic taste in the mouth. This is another symptom tied to waste product buildup, sometimes affecting taste perception and digestive comfort in ways that are subtle at first, gradually leading to reduced food intake and sometimes unintentional weight loss over time, similar to what we discussed in our Unexplained weight loss video, which makes this an important overlapping symptom to keep in mind between the two topics. The sixth is muscle cramps, especially at night, often affecting the legs. Kidneys play a central role in maintaining the balance of electrolytes in your blood, including calcium, phosphorus, potassium, and sodium. As kidney function declines, this balance can shift, and imbalances in these specific minerals are strongly associated with muscle cramping, particularly the nighttime leg cramps that many people experience but rarely connect to anything beyond simple dehydration or overexertion. The seventh is difficulty concentrating, dizziness, or disrupted sleep. This ties together several of the mechanisms we've already discussed. Anemia reduces oxygen delivery to the brain, contributing to difficulty focusing and dizziness, while waste product buildup and imbalances in body chemistry can interfere with normal sleep patterns, sometimes contributing to a specific and uncomfortable sensation in the legs at night that disrupts rest. Individually, each of these can have countless other explanations, which is exactly why this symptom in particular tends to be missed or attributed to stress, aging, or poor sleep hygiene, rather than considered alongside kidney function. I also want to mention one more important sign, even though it functions differently than the 7 above: high blood pressure that's new, worsening, or difficult to control. High blood pressure has a uniquely bidirectional relationship with kidney disease. It's one of the leading causes of kidney damage, but declining kidney function can also itself cause blood pressure to rise, creating a cycle where each condition worsens the other. If your blood pressure has become notably harder to manage despite consistent medication and lifestyle habits, that's worth specifically asking your doctor whether kidney function should be checked as part of that conversation. Now let's talk about who's at higher risk, because this affects how seriously any of these signs should be taken and how often screening makes sense. Diabetes is the leading cause of kidney disease worldwide, since chronically elevated blood sugar damages the small blood vessels within the kidney's filtering units over time. High blood pressure is the second leading cause, through the mechanism we just discussed. A family history of kidney disease meaningfully raises individual risk, as do certain inherited conditions. Age itself is a factor, since kidney function gradually declines to some degree as part of normal aging, making it harder to distinguish normal age-related decline from disease-related decline without proper testing. Obesity, smoking, and a history of frequent NSAID use, common over-the-counter pain relievers like ibuprofen and naproxen, when used frequently or at high doses over long periods, also contribute meaningfully to kidney strain over time. If several of these risk factors apply to you, that's a reason to be more proactive about testing, not more anxious about symptoms. Let's talk about what testing actually looks like, because this is refreshingly simple compared to a lot of other conditions we've covered on this channel. Two tests form the core of kidney function screening: The first is a blood test measuring creatinine, a waste product that healthy kidneys filter out efficiently. From this measurement, along with your age and sex, doctors calculate a number called your estimated glomerular filtration rate, or eGFR, which reflects roughly what percentage of normal kidney filtering capacity you currently have. The second is a urine test checking for albumin, a protein that shouldn't normally be present in meaningful amounts, often expressed as a urine albumin to creatinine ratio. Together, these two tests, both simple, inexpensive, and available through routine blood work and a urine sample, can detect kidney disease well before symptoms would ever appear, which circles back to why proactive testing matters so much more than waiting for the 7 signs we've discussed to show up on their own. If kidney disease is caught, it's worth knowing that the treatment landscape has genuinely changed in meaningful ways recently. For a long stretch of time, treatment centered almost entirely on blood pressure control and slowing progression through lifestyle changes, with relatively few options beyond that. More recently, newer medication classes, including a category originally developed for diabetes that also protects kidney function, have been shown to meaningfully slow the progression of chronic kidney disease in ways that weren't available even a few years ago. This doesn't mean kidney disease is something to take lightly if diagnosed, but it does mean that catching it early, when these treatments can do the most good in preserving remaining function, matters more than ever. And a diagnosis today comes with more genuinely effective options than it would have not long ago. Let's talk about what actually helps protect kidney function, whether you're managing a diagnosis or simply trying to reduce your risk. Managing blood pressure and blood sugar, if you have diabetes, are the two most impactful things within your control, given how central both conditions are to kidney damage. Staying adequately hydrated supports healthy kidney function, though it's worth knowing that more water isn't automatically better beyond a normal, adequate intake. This is a sufficient, not maximize, situation. Being mindful of how frequently you use over-the-counter pain relievers like ibuprofen and naproxen, particularly avoiding regular high-dose use over extended periods, meaningfully reduces one avoidable source of kidney strain. Not smoking supports kidney health alongside its many other well-known benefits. And if you have diabetes, high blood pressure, or a family history of kidney disease, asking your doctor specifically about a kidney function screening as part of your regular checkups, rather than waiting for it to be automatically included, ensures this actually gets checked, rather than falling through the cracks. Let's clear up a few myths before we close, since they tend to create either false reassurance or unnecessary panic. Myth 1. If my urine looks normal, my kidneys are fine. As we've covered, several of the earliest and most common signs of declining kidney function have nothing to do with how urine looks, and even changes that do relate to urination, like foamy urine, are easy to miss unless you're specifically looking for them. Myth 2. Kidney disease only happens to people who don't take care of themselves. While diabetes, high blood pressure, and lifestyle factors do raise risk, kidney disease can also result from genetic conditions, autoimmune disorders, infections, and other causes unrelated to lifestyle, so a diagnosis isn't automatically a reflection of personal habits. Myth 3. Drinking more water always protects your kidneys. As mentioned, adequate hydration matters. But excessive water intake doesn't provide additional protection beyond a normal, healthy amount. And in certain kidney conditions, fluid intake actually needs to be carefully managed rather than maximized, which is exactly why this is a conversation to have with a doctor rather than a blanket rule to follow. And myth 4, there's nothing you can do once you're diagnosed. As we just covered, current treatment options meaningfully slow disease progression, particularly when started early, which makes an early diagnosis considerably more actionable today than it would have been in the past. To bring this together, changes in urination, swelling, persistent fatigue, unexplained itching, appetite changes, muscle cramps, and difficulty concentrating or sleeping are the 7 signs most commonly missed. precisely because each one on its own has countless other possible explanations. None of these symptoms alone means you definitely have kidney disease. And that's not the point of this video. The point is that if several of these apply to you, particularly alongside risk factors like diabetes, high blood pressure, or a family history of kidney disease, a simple blood and urine test can answer the question definitively, far earlier than waiting for symptoms to become undeniable. If this video was useful, the most helpful thing you can do is share it with someone managing diabetes or high blood pressure, since they're exactly the audience this information matters most for. Subscribe for more evidence-based health content, and I'll see you in the next one.